Personalized cancer treatment is a phrase we hear more and more often. Dr. Lowell Hart of Lee Memorial Health System explains.
Personalized cancer treatment has been one of the areas that our profession has focused on in the last several years. We're trying to move cancer treatment from beyond just the shotgun approach where we try to kill large numbers of cells to try and find what pathways the cancer cell may be dependent on so we can attack it where it's weakest. The starting point of this has been looking for some gene profiles in the cancers to see which gene pathways are expressed, which genes are not expressed, so that we can try to make a snapshot of the cancer. So more and more now, doctors, both in research settings and to some extent in private practice settings, are trying to get these pictures of the patient's cancer when they're first diagnosed. Then we can sort of try and mix and match that to the treatments that may be available. In the future, we're obviously trying to develop newer treatments that hit these targets. For some of the targets, we have treatments that have already been approved by the FDA. And some of the other targets, these newer treatments are still on clinical trials, having clinical studies going on. Cancer treatment is not yet personalized for every cancer. That's certainly one of the big goals of the National Cancer Institute, and I would say is probably the #1 goal of our cancer program as a whole over the next decade. There's some types of leukemia. Chronic myelogenous leukemia is a type of cancer where it's dependent on exactly one pathway. We found that there are drugs now that specifically target that pathway with very little toxicity to other parts of the body, and it's been a tremendous breakthrough and hopefully a magic cure for many patients. Now, we don't have that for all cancers because some cancers use multiple pathways, so it's more complicated for some of the common cancers such as breast cancer, colon cancer, prostate cancer, and lung cancer. But we're getting a lot closer towards that. So there are targeted therapies now available for almost every cancer. They're not going to cure every patient, but we're moving in that direction. And that's one of the reasons that the cancer death rate for many of the common cancers has started to plateau and go down. Even though the amount of cancer is still going up in our country, the death rate is starting to plateau and go down for many of the common cancers. So that's a sign that we're being more successful with the treatment. It certainly makes common sense that if you can find the Achilles heel, the weak spot of their particular cancer, and target a treatment towards that, you're going to leave a lot of the normal tissues undamaged. What patients are most afraid of, I think, is the cancer itself, and then they're also always concerned about the toxicity or side effects of the treatment and how damaged are they going to feel, how tired are they going to feel. So the more normal cells that we can leave behind undamaged while we target the cancer cells, the better it's going to be for the patient. So I think this whole process of individualizing treatment is tremendously hopeful for the cancer patients and gives them a vision that the future is going to be better than the present and with less side effects, better cure rates. And even if we can't cure patients, our hope is to turn many common cancers into chronic illnesses where even if the patient cannot be completely cured, I often tell my patients we're trying to keep the lid on your illness for many months or hopefully many years, and I think we've made tremendous progress in that direction over the last decade.